Today is Vice President of Population Health at Henry Ford and Henry Ford Jackson Hospital, Dr. Courtland Keteyian. Good afternoon.
Hello.
Happy COVID anniversary.
Thank you. I guess it is, isn't it? It's
4 years ago today.
4 years ago.
World Health Organization declared a pandemic.
Yep.
Still with us?
It is still with us. Yeah. I actually remember it was on a Friday, well, that was the day that that the president declared the state of emergency, because we ended up putting up the drive-through testing facility overnight. So he declared the emergency on Friday, and by Saturday at 8 a.m. we had drive-through testing at 1 Jackson Square. And then the line of cars snaked all the way out into the parking lot and into the street, and so the police were not happy with us. But yeah, we were up all night putting that together.
I remember people were desperate to get tested, and then we had to wait, I think it was a week before we got the results.
It took about a week to get the results back at that point. There was so many tests, and there were no supplies to do the tests. We didn't have reagent, we didn't have swabs, we didn't have, so there was a lot of demand, yeah.
Yeah, and then we ran out of all the PPE
Yeah.
that you needed to conduct the test.
You know what was cool though too, this is, kind of fun to reflect on, there were a lot of, people kind of pulled together in this community, and actually, there were people making PPE. There were companies here that actually manufactured face shields for people in the hospital that actually were making masks. So even though there were kind of national shortages of some of these things, there are manufacturing companies here locally that had pitched in and were able to make equipment that we needed. So it was pretty amazing actually to see that. So yeah, I don't really want to go through that again, but it was really interesting to see the community pull together. It was super cool.
Yeah, it was. A lot of examples of the community and people pulling together here. I think that's one of the neat things about Jackson.
Yeah.
All right, so that pandemic, it's now being treated like the flu or any other seasonal illness.
Yeah.
But we have a new thing to worry about, and that is measles. We have in less than 2 weeks, 3 cases in the state of Michigan.
That's right. Yeah, a new old thing. So measles is a very old virus. It's been around for a very long time. The 3 cases that are in Michigan right now, and there's cases all over the country. The 3 cases that are in Michigan are not related. One is in Oakland, one is in Wayne, and one is in Washtenaw counties. Those people have all been put into isolation, and they're followed by the health department. These cases seem to be associated with international travel, but it's the thing to know with measles is that it is extremely easy to spread. Probably the most infectious disease that we know of. And so actually when we were talking about COVID before and how easy it is to spread COVID, we would often compare to measles as kind of the bar, right? Like measles is really easy to spread. So there's a number we use, it's called the R0. This is what epidemiologists use. And with influenza, the R0 value is somewhere around 2. So that means that one person that has it is likely to infect 2 other people. With COVID, the number seems to be current variants of COVID, about 4 to 5. So one person with COVID will infect 4 to 5 others. For measles, that number is 16.
Oh my gosh.
So it is extremely contagious, and it's a respiratory virus, so you spread it from just talking to somebody, right? In just respiratory droplets. And the virus is so stable that somebody could cough or sneeze in a room, and 2 hours later, somebody could walk into that same room and get measles. So it's extremely, extremely easy to spread with other people. So it's kind of uniquely infectious that way.
All right, so measles was eradicated,
We thought.
we
Yeah.
thought,
Yeah.
because people would be getting vaccinated for that as just a regular course of,
Yep.
but vaccinations, people stopped, and a lot of are saying, well, it's because of COVID or during COVID that people decided that they were not going to get vaccinated for anything,
Right.
including measles.
Yeah, that's that. Or they've spread out the vaccines, right? And so it leaves kind of gaps in herd immunity. In Michigan, so the schedule for measles, it's the MMR vaccine, measles, mumps, and rubella. That vaccine is supposed to be given at 12 months, right? So a child turns 1 year old. That's in the first birthday series. And then the second dose is given between ages of 4 to 6. It's extremely effective. So one dose of the vaccine, the effectiveness is about 93%. And if you have the second dose, it's about 96, 97%. So it's a very, very effective vaccine.
So I don't know when I got my last measles vaccine, but at my age, am I at risk?
So if you were born before 1957, you're considered essentially immune by the probability of having it.
Perfect.
Yeah.
I beat it by 1 year.
And then everyone else then would have been. I mean, you had to have it. It's required to actually go to school to have the measles vaccine. I mean, it's you've had to have it. So. Our vaccination rates in the last 5 years have dropped about 5% in Michigan. So, I don't know these numbers right off the top of my head, but I think I heard about 83% or something is where we are now.
Today, Dr. Bagdasarian, the MDHHS Chief Medical Officer, she said, we are at childhood vaccinations have dropped to 66% among toddlers, and she says that means a measles outbreak is imminent.
Yeah, I would say that it's almost guaranteed, right? I mean, you can't something that spreads like this. To have herd immunity, you have to have a vaccination rate that's up around 90%, and we're just not there with. And that's actually pretty scary for kids, because if you've got an infant, a child less than 1 year, cannot get the vaccine. It doesn't work. So you have to wait until they're 1 year old and their immune system has developed enough.
But they're susceptible to getting measles.
And they're susceptible to getting measles. And so the probability of hospitalization with measles is about 20%.
1 in 5.
1 in 5 will be hospitalized. So it's very serious if you get it. And then, so 1 in 5 hospitalized, and the reasons for being hospitalized, the pneumonia is the most common, but there's another condition where you get swelling of the brain or encephalitis, which is very serious. And so 20% will be hospitalized. About 3 in 1,000 people die with measles. So it's not something you want. It's not something you want, especially when there's a good vaccine. The good news about the vaccine too is the vaccine also works after an exposure. So if somebody has been exposed to measles, reach out to your doctor as soon as possible, right? And or the health department, depending, right? The health department is very involved in these types of cases. You can be vaccinated up to 72 hours after the exposure, and it still is protective. It'll reduce the probability of being hospitalized or getting really sick.
So obviously, if you're a parent and your child is 1 or older and they haven't had the series of vaccines,
Yep.
they need to do it.
Yeah, you really, really need to do it. And also pregnant women, if are not vaccinated. Measles is not something you want when you're pregnant. It causes early deliveries, causes low birth weights. People have much worse outcomes from pregnancy if they get measles. So yeah, anybody that's really not vaccinated should be getting vaccinated. There's really not a good reason not to have a measles vaccine.
Before the show, you were telling me an anecdote about how communicable this disease is that happened a few years ago.
Yeah, so like the famous the famous story or the famous case that really kind of, I think, cemented how easy it is to spread measles was in 1991, the Special Olympics were in Minneapolis, St. Paul. And at the opening ceremony, this is how good I think actually public health officials are at actually tracking, right? And so that this was published. It's a very well-known study, and there was an athlete from Argentina that had measles. One athlete that had measles from Argentina, and there were people sitting at the top row of the stadium, and so that was estimated to be about 30 meters away from the entrance to the track, who contracted measles from the athlete from Argentina. Right, so outside 30 meters away, and somebody still got it. That's pretty amazing, actually, that something can spread like that. COVID doesn't do that, right? I mean, this is really, really easy to spread. And part of the problem, I mean, this person was obviously there for, like a competition, right? So they were feeling okay. So measles. So the characteristic symptoms with measles are cough, coryza, which is like a runny nose or a stuffy nose, and conjunctivitis, so getting redness of kind of the whites of the eyes. Those are kind of some of the first things, and then people get this very characteristic, they get spots in their mouth and then a rash that usually starts from their head and goes to their toes. So until you get the rash is like pathognomonic. Like when you see the rash, that's when people can say, oh, this is measles, right? People know that rash, or the spots in the mouth, right? And those don't happen until kind of day 3 or 4. Before that, you just have kind of regular upper respiratory symptoms, right? But that's the time when people are the most contagious, before they know they have it. And you actually spread the disease for 4 days before you have symptoms.
Oh my gosh.
So that's part of the issue, is that, of course, if you're sick, stay home, right? But people can spread it before they know they have it. And that's where things kind of get out of control very quickly, where you have a large percentage of the population that aren't vaccinated because you don't know that you've been exposed.
Well, I can't believe this. Dr. Vaccinations says 66% among toddlers aren't. That's the vaccination rate. How are these people getting into school?
So there are abilities for people to have
the exemptions,
religious and like philosophical exemptions to vaccination. So it's required unless you go through the effort of getting these waivers. And so that's how you end up in a situation like that.
Great. All right, well, get vaccinated. Get your kids vaccinated. You don't want to be going to the hospital. And then is there a treatment for the people
so
that...
it's really supportive. So so if somebody's exposed, you can vaccinate them if it's early, right? Which is really the best, treatment, so to speak. But then other than that, no, there's no medication. You treat the symptoms. So if somebody develops, a respiratory pneumonia and they have to go to the hospital, right? You're treating their breathing, you're doing other things to support, they have to give them oxygen, right? What they would need to. But if you develop encephalitis, right, that's the same thing, right? That's very much supportive care, and your body has to solve that pretty much on its own.
Wow.
Yeah.
All right, so we're still in flu season, even though we've had a mild winter, and now MDHHS reporting over the weekend that the state's first influenza-linked pediatric death for this flu season has been confirmed, and that's horrible tragedy.
Yeah.
But it happens every year. We do have...
Happens every year. Yep, happens every year, and usually not if somebody's been vaccinated. The flu vaccine is pretty effective at preventing hospitalization, pretty much like COVID, right? Very effective at preventing kind of the worst complications, hospitalization and death. But yes, we do have people, and we do have kids that die pretty much every year from influenza, which most people don't really realize. You know, it's something we kind of think of as something we just kind of deal with, right? It's kind of part of life that we have. We have influenza every winter, but it can be serious for young kids, especially the ones that are too young to get the vaccines.
Do whatever you can to not get sick, and that includes all of the things that have been developed.
Yeah, you know, it's interesting. Like, people were all wearing masks like pretty consistently during COVID, and that works. That works really well. A lot of these diseases are respiratory spread, and you know, if you feel symptomatic, even if you're like, well, you know, I'm feeling well enough to go to work, but I have a runny nose, right? Like, put on a mask. I mean, because the idea is really source control. It's that the person who's sick doesn't spread to others. And we all, there's great studies on this too, like just talking, right? People have respiratory droplets that are spread, right? Laughing, talking, coughing, sneezing, right? We spread, you know, you can sneeze and spread respiratory droplets 15 feet, right? So those are the ways that we spread these respiratory diseases. And so if somebody's ill and you put a mask on that person, the probability of getting another sick is very low. The masks work really, really well. And washing hands is part of it too. So it's sort of hand washing, social distancing, but wearing masks and that source control really helps.
And that seems like that social distancing that has continued. If you're standing in line at a whatever, you notice we're doing that, which is it's respectful, but it's also safe. We also have weight loss drugs. I wonder how many people are getting an Ozempic injection that won't get a vaccination.
There's a lot of things people will have injected into their bodies, but they won't get a vaccine, which I always think the psychology of that is really interesting. Or drugs people will take that, you know, we don't know. I mean, you think about, people take all these supplements that, you know, are really not regulated by the FDA, and people are happy to take those, but, you know, won't get a vaccination. We've had studies in, you know, hundreds of thousands of people. So, that's like really interesting psychology. But there's a lot of people now that are on, it's actually shortages of these drugs, right? Ozempic, or semaglutide, which does help cause weight loss. But we don't have enough of it to treat people that actually have diabetes, because there's so many folks that are trying to get their hands on it for weight loss.
And it's $1,000 a month.
It's expensive. Yeah, it's very expensive.
And you're right about the supplements. I love the ads that say, this is the #1 pharmacist recommended supplement. Well, of course they're going to recommend. They're pushing it. They're selling it. All right.
The thing about Ozempic, just maybe one more point there, is that there isn't good data yet long term that once people lose weight, they keep the weight off, right? They have to kind of stay on these medications long term, which is really not realistic, right? I mean, these are very expensive medications, and so to have to be on that continuously, we don't know what the long-term effects are going to be of being on a drug like this. It kind of messes with your metabolism. So, so at least for now, it's kind of seems to work, right? Short-term reduces people's appetite and they lose weight, but can somebody actually stay on that long-term and sustain the weight loss? It's really not clear that's the case.
God bless you if it's working for you and you found something that is helping you be healthier. Yes, that's great. So there we have it. Well, as always, thanks for all your expert information.
Yeah, thanks for having me.
Daylight savings time affecting our health negatively?
There's actually a lot of studies that show that daylight savings is not good for people.
Yeah.
That's pretty that's pretty definitive in the medical literature. And you know, there's actually, the debate is about what's better, right? Sort of, you know, which time, right? Is it better to be like an hour earlier, an hour later? That probably doesn't matter as much as the switching. There's a lot of negative health consequences of people. There are more heart attacks. There's more car accidents like the day after you switch. People are tired. It's like, this actually really is harmful for people.
Makes sense.
Yeah, we need to pick one.
All right, daylight saving time. From Henry Ford Jackson Hospital, VP of Population Health, Dr. Courtland Keteyian.